10 diseases that can kill you in less than a day, unlike malignant tumors. At one time, I felt the changed attitude of those around me towards me as if I were a living corpse, or a convicted criminal sentenced to death when I was undergoing treatment for cancer. This was expressed in their glances, tone of voice, and the content of conversations when I had to interact with them either personally or indirectly through mutual acquaintances. One example: if someone had my phone number in their contacts, they would invite me to their birthday through third parties. I won't hide it, this attitude, given my cancer diagnosis, which I did not conceal, was influenced by my bald head, altered skin color, and drastic weight loss, more than half of my normal weight to the appearance of a cachectic patient. Meanwhile, unlike those acquaintances who had already buried me alive, I clearly knew what my chances of survival were at the 4th stage of the disease, and I was determined not to miss them. And, thanks to my family and kind people, I did it. In principle, I already knew and understood that with the right treatment, it is possible to live a significant number of years even at the 4th stage of cancer, given the right desire and circumstances. But even in cases where both the localization and the histological type of a malignant disease currently provide bleak prognoses in modern oncology, this does not mean an immediate death. Rather, it is a death stretched over a period of time that can be used productively for oneself. And who knows, perhaps during this time scientists will discover a new way to fight against what you have had to face. In any case, an oncology patient always has more chances than a person facing other diseases that can kill us in just one day. That's what I want to talk about now. Deadly diseases. Bubonic plague. Bubonic plague is one of the deadliest diseases in history. In the 14th century, it killed over 50 million people. Contrary to popular belief, the disease still exists today, with most cases occurring in Africa, Asia, and South America. The disease is caused by the bite of a flea from an animal that carries the bacterium Yersinia pestis, for instance, from a rat. The most common symptoms are fever, vomiting, delirium, and swollen lymph nodes. The incubation period can last up to 24 hours. Bubonic plague results in fatalities in 30 to 60% of cases. Deadly diseases include Ebola. The Ebola virus has caused thousands of deaths in Africa. The disease is transmitted through the blood, secretions, and other biological fluids of infected animals, such as chimpanzees, gorillas, gazelles, etc. Then, a person with Ebola fever can transmit it to another person through direct contact. After an incubation period of 21 days or less, the first symptoms appear: fever, muscle pain, headache, and sore throat, followed by more severe symptoms such as vomiting, diarrhea, rash, and internal and external bleeding. Sometimes there is only 24 hours between the onset of symptoms and death. The mortality rate ranges from 25% to 90%. A deadly disease is cholera. Cholera is an intestinal disease caused by drinking water or consuming food contaminated with a bacterium called Vibrio cholerae. According to the World Health Organization, between 21,000 and 143,000 people die from this disease each year. After an incubation period of 12 hours to 5 days, the disease causes severe diarrhea. Without proper treatment, the infection leads to severe dehydration and soon thereafter, death. It is important to treat the disease immediately after the symptoms appear. With proper treatment, the mortality rate is less than 1%. Without treatment, 1 in every 2 people dies from the disease. The deadly disease is meningitis. Meningitis is an infection of the meninges caused by a virus or bacteria. The disease is more common in infants and young children, but adults are still susceptible. It is most often contracted through contact with the saliva of an already infected person. The symptoms of meningitis are similar to those of the flu: headache, fever, stiffness of the neck muscles, and sensitivity to light. Unfortunately, this disease is much more dangerous than the flu. 1 in 2 people dies from it, and from 10% to 15% of survivors suffer from severe neurological disorders for the rest of their lives. Deadly diseases. Flesh-eating disease. Necrotizing fasciitis, commonly known as flesh-eating disease, is a bacterial infection that affects the soft tissues of the body. It typically enters the body through open wounds or small cuts. The most common symptom is skin necrosis. The epidermis turns blackish-purple. However, before this occurs, the infected person will experience fever, chills, and redness of the skin. In most cases, to slow the spread of the infection, doctors often have no choice but to amputate the infected limb if the bacteria have not yet killed the patient. Approximately 30% to 40% of people diagnosed with necrotizing fasciitis die. Deadly diseases: lightning-fast hepatitis. Fulminant hepatitis has several causes, such as herpes and shingles, but it is usually caused by hepatitis A and B, which is why it is important to undergo regular screenings. Regardless of the cause, seek medical attention immediately if you notice any of these symptoms: severe fatigue, abdominal pain, and jaundice. Fulminant hepatitis results in death in 40% of cases. It attacks and destroys liver cells. Without this vital organ, the body cannot detoxify, leading to rapid death. In advanced stages, the only treatment is a transplant. Deadly diseases include methicillin-resistant Staphylococcus aureus, MRSA. Methicillin-resistant Staphylococcus aureus is a bacterium resistant to most antibiotics. Infection occurs through direct contact with a carrier of the bacteria. Typically, MRSA manifests as red bumps that are swollen, filled with pus, warm to the touch, and painful on the skin. Usually, draining the pus is enough to eliminate the infection. However, the bacteria can spread to other parts of the body, such as the lungs or urinary tract. The illness causes fever, chills, confusion, and muscle pain. In 10 to 30% of cases, the patient dies shortly after the onset of symptoms. A deadly disease is enterovirus D68. Enterovirus D68 is a virus that affects the respiratory tract. It is transmitted through saliva and coughing. Infants, children, and adolescents, especially those suffering from asthma, are at the highest risk. Symptoms often resemble those of the flu: fever, runny nose, cough, sneezing, and muscle aches. If left untreated, enterovirus D68 can cause serious respiratory problems, which can quickly lead to death. According to one study, about 1 in 10 people infected with the virus will die. Fatal diseases include acute pancreatitis. Acute pancreatitis is inflammation of the pancreas. In some cases, the inflammation progresses to necrosis, which can result in death. The first symptoms of the disease are digestive problems and severe abdominal pain radiating to the back. These symptoms often appear after eating. Some people also suffer from nausea and vomiting, as well as fever, sweating, and difficulty breathing. The mortality rate for acute pancreatitis ranges from 5% to 30%. A fatal disease is Chagas disease. Chagas disease is caused by the parasite Trypanosoma cruzi, which is transmitted to humans by triatomine bugs, also known as kissing bugs. According to the WHO, between 6 and 7 million people are infected, primarily in South America. Chagas disease has 2 phases. In the first stage, which lasts about 2 months, the patient does not notice any symptoms. Once in the patient's bloodstream, the parasites spread to the heart and digestive muscles. Then the patient suffers from heart or digestive issues, such as heart failure or arrhythmia. This is the second phase. If left untreated, the disease can lead to sudden death. Fortunately, treatment is almost 100% effective if administered in a timely manner. The mortality rate is relatively low, less than 5%. Overall, that's about it. Let's dismiss the stereotypes about cancer patients. Don't write us off from your life if it turns out that we live longer than you expected. Don't be in a hurry to bury us.